the Venus Versa machine is its treatment of spider veins. And back in April of last year, I started a little bit of spider vein treatment, and we followed up in October. These are not the ideal intervals. We should have been treating every 3 to 4 weeks after the initial treatment, but it's a busy clinic, so we only work this in when we can. But today is my third follow-up on these spider veins that are occurring down in the arches of my feet. We'll show you some befores because there has been significant progress, but definitely we can do some more here too. But we're going to be treating these areas in here, on my left foot, and then some areas here. If you look at the earlier pictures of my right arch, there was a lot more spider veins in this area. So we're going to come back and do those. These are just kind of marking out the area so I have some good indications here. And good, then what I'm going to do next is gel up as part of the procedure. That's just getting some gel on there so that we can start our laser therapy. So we got my feet all gelled up here and ready to go. I've got my safety goggles on, my stylish safety goggles on, and we're ready to go. So I'm going to grab the head of the IPL machine. I'm going to double check my readings. That's everywhere we want to be. I'm going to go ahead and engage here. You're going to see some bright lights, and we're going to start to work on some of these little spider veins, see if we can get them to finally go away here. So what we're looking for after we flash them with this very powerful beam of light is for them to either blanch a little bit, turn white, or a darker gray. Sometimes they'll turn more purple, or they'll turn black. Those are the endpoints that we're looking for when we're treating these. So here we go. I'm going to place this on the first location here. And sometimes we can hit these spots a couple of times. There. Okay. That's there's a sensation when you see that flash of light. It feels like a little rubber band, maybe kind of stinging the skin a little bit. Not bad at all, especially in this kind of area. It's a little bit sensitive here, so we're going to keep moving around. Again, I feel that little bit of a sting there. Always a little pain and getting beautiful here. Hitting these veins. So that was our last flash, and what I'm doing is just looking for some of these endpoints. Like I said, you should see some blanching, whitening of the veins, or in this case what we're seeing is a little bit more darkening of the veins, and that means that the light has sought out the structure in the veins and has kind of obliterated that. And what will happen is these will continue to darken over the next few days. Probably from 3 to 7 days, they'll start to resolve. So again, that darkening would be the gray, the purple, or the black. And those are good signs if they start to turn that color. That means the light has hit those structures and are starting to break down the veins themselves. Now, these veins are not operative. In the destruction of these veins, we're not hurting the circulation in the foot at all. There's plenty of what we call collateral or secondary veins that will help with all the circulation that needs to happen in that area. So I think I'm going to go back and just touch up a few more areas here. So let's just go ahead and do that. So there was a little bit of hair that we zapped in there. That is called the smell of success. So yeah, it kind of fries a little bit of hair, so you get a bit of a sulfur smell, I think that is, some of the constituents of hair there. You can see in these close-ups that we're getting a little bit of redness in the area, identifying some of the hemoglobin, the red element of the blood. That's what the light is being attracted to. And so we are getting some good vein destruction. Again, these are going to darken up a little bit. That's a good sign. I know that doesn't seem like a good sign from a completely aesthetic kind of standpoint, but a good sign from what ultimately we hope to see happen. These destroyed veins get assimilated by the body very quickly. Like I said, usually in about 3 to 7 days at most. So we'll keep these covered. You definitely want to keep out of the sun these areas that have been exposed to this very intense light. It's very important that they stay out of the sun for at least a week, sometimes better than 2 weeks. And we'll hopefully, if we need to, repeat this procedure in about 3 to 4 weeks again. And again, trying to stay out of the sun during all that time. It's really good to do this kind of stuff in the winter when people are a little bit more covered up. We're not wearing open-toed shoes and those kind of things, sandals and stuff so much, where this treated area might get exposed to the sun. So wintertime, a great time to do spider vein treatments. Hope you found that spider vein treatment interesting. It really is a quick thing to do. We'll look to see if those spider veins are resolved here. We'll keep you posted on that. If you're interested at all in spider veins or any type of the facial rejuvenation thing, getting rid of age spots, all those kind of things that can give away our age, call for a free consult on that. We'd love to talk to you guys about doing that. Stay tuned for more videos on more procedures and other things here at Krch Aesthetic Medicine.